Welcome, everyone. We are just going to give it a minute to let everybody get into the webinar. But while we're waiting, if you want to just put your name and your where you're coming from in the chat, that would be great. We'll get started in just a second here. All right, let's go ahead and get started. It looks like people are still joining us, but I want to make sure we have plenty of time to get through all of our information here. So welcome again. If you're just hopping in here, if you could drop your name and where you're coming from in the chat, that would be great. And we'll go ahead and get started. I am Heather Tritton. I am the president and CEO here at the Colorado Children's Campaign. And I get the pleasure of welcoming you all to this event. And I'm really happy that so many people are joining us. We're really excited to share where we're at this point in the legislative session. And so let's go ahead and get started. If you want to go to the next slide. So the Colorado Children's Campaign is a nonpartisan, nonprofit advocacy group, and we are committed to realizing every chance for every child in Colorado. We have been around since 1985, and we advocate for the development and implementation of equitable, data-driven public policies that improve child well-being in health, education, early childhood, and family economic prosperity. And I know some of our funders and supporters are on the call, so thank you for your support. And we can't do what we do without all of our partners and funders. So thank you for all that you do, not just being here today. Just quickly, here's our agenda. Today, you'll be hearing from our entire policy team about the issues that we've been advocating for or tracking during this session. And we know that you'll have questions, and we are going to leave time at the end to answer questions. But during this time, like as we're speaking, if you want to put questions into the Q&A function, we will be pulling them out of there for our Q&A conversation at the end. So just a couple of housekeeping items before we start. Again, if you have a question, put it in the Q&A, and we will take time at the end to answer all the questions, as many as we can. And then we are also recording this webinar, so you'll receive a follow-up email later today or later this week with a link to the video so that you can come back and watch it or share with others. And we will also be sharing resources in the chat throughout the webinar, so please just keep an eye on that, and feel free to put comments in there as well. So before we start, I just want to kind of do a little bit of level setting, because we have some interesting trends in the legislature this year, and one of those is that we've had some complex dynamics, and these started even before the legislative session started. And you might remember in the fall we had, or right before the session started, we had some legislators who resigned because of sort of the heat amongst themselves at the Capitol. And we do have a supermajority of Democrats, and so we're seeing more sort of complicated relationships between not just Republicans and Democrats, but also Democrats and Democrats and Republicans and Republicans. So it's an interesting session where we're just dealing with some things that we don't typically see. We also have a tighter budget, and there are a lot of proposals. You're going to see some things in a couple minutes here that cost a lot of money, and we have less money to fund that. And this really is tied to our Tabor constraints that we have here in Colorado. And because the legislature has to return money to taxpayers, that means they have less money to figure out what to do with when it comes to bills and policy priorities at the legislature. We're also seeing some budget constraints because of the loss of some of the pandemic era supports. So a lot of those funds are winding down this year or next year. And so there are a lot of conversations around how do we either wind down programs or replace those funds so that we can keep things that we have created over the last couple of years in place. So a little bit different year this year, but still a lot going on. And I am going to pass this off to Sarah Barnes, who's going to talk about our family economic prosperity work.
Thanks, Heather, and thanks everybody for being here today. My name is Sarah Barnes. I use she, her pronouns, and I'm the Senior Director of Policy here at the Children's Campaign, as well as our Director of Family Economic Prosperity. And I'm really excited to share a few updates with you all about some exciting things that are happening in the family economic prosperity space at the Capitol this session. Just as a reminder, this is the Children's Campaign's North Star goal for how we're thinking about our work in family economic prosperity. And this year in 2024, we're really focused on two different priority areas in family economic prosperity. And those are preventing families from being evicted and also making sure that families have adequate income supports to thrive. So I'm really excited to start today by sharing an update on Senate Bill 64 around eviction data. This is a bill that we are co-leading with Enterprise Community Partners this session to improve the way that we collect and publish data trends from residential evictions in our state. So this bill specifies which data points will be collected from our residential eviction court filings in Colorado, and then requires that data to be published on a regular basis in an aggregated way that protects parties' personally identifiable information. At the Children's Campaign, we know the importance of data and that what gets measured gets changed, and having consistent data on evictions in our state will really help us to inform policy solutions that will prevent families from being evicted in the first place. Senate Bill 64 passed out of the Senate Judiciary Committee, and it is now in the Senate Appropriations Committee. We're also really excited this session to be supporting a bill that would eliminate filing fees for renters who are facing an eviction. And this bill is being led by our partners at the Coalition for the Homeless and at the Colorado Poverty Law Project. Requiring families to pay a fee to file an answer to an eviction complaint or to go through an onerous process of qualifying to get a waiver of that fee makes it more likely that family won't file an answer in an eviction proceeding, and this leads to more families being evicted through a default judgment because they're not able to participate in the proceeding. So we're really excited to support this bill this session that will eliminate that fee for renters who are facing an eviction. House Bill 1099 has passed out of the House Committee on Transportation, Housing, and Local Government, and it is now in House Appropriations. We're also really excited this session to be supporting some bills and working on some bills that will help put money into the pockets of families who can benefit from that the most. And one great example of this is House Bill 1311. This bill will provide a tax credit to eligible families, and it has a particular focus on low-income families with young children. There are over 133,000 kids in Colorado who are experiencing poverty, and we've seen that these types of direct cash payments to families are one of the best tools we have to lower the child poverty rate and to help families meet basic needs. As Heather mentioned, Tabor really limits our state's ability to fully invest in programs that support children and families, but bills like this one are one way that we can target resources to families who need them the most. And we're also really excited to support House Bill 1288 this session. This is a bill that'll help decrease silos in our public benefit system and increase access to income supports for families. And this bill is being led by our partners at Geary Community Ventures. The process of finding and navigating information about public benefits is often very confusing and time-consuming for families. This bill would take some important steps to increase coordination between our state agencies for purposes of benefit outreach to families. And it also would increase access to the EITC and the CTC for eligible families who might not have claimed those. And we know that these are the two most powerful tools we have to lift children out of poverty. This bill has passed out of the House Committee on Finance, and it is now in House Appropriations. I'm happy to answer folks' questions in the chat and at the end, but for now, I'm going to turn it over to my colleagues, Melissa Mates and Lauren Corboy, to give some updates on early childhood policy priorities.
Thank you, Sarah. Lauren and I are really happy to be here to share updates on early childhood this year. I'm the director of early childhood. Lauren is our amazing senior policy analyst, and many of you may have heard from us before in different settings, but we are your contacts for early childhood questions and wonderings. Next slide, please. This is our North Star goal for early childhood, and it's important to us specifically because we have both been early childhood educators in the past. I have experience teaching first grade and kindergarten, and Lauren came to the Children's Campaign from teaching kindergarten and preschool. So we've seen firsthand what it means that families have disparate access to early childhood programs and services and how much we need to change that outcome for kids in our state. Next slide, please. These are our early childhood priorities, and you may be wondering, my goodness, those are gigantic buckets of work. These are broad focuses. We understand that, and in a second, you'll hear from Lauren, who will go into more detail about what this means for our work in 2024. But really, since 2020, with the passage of Proposition EE, we have been looking at systems level change, systems level improvements, because we heard loud and clear from Coloradans, including early childhood program providers, advocates, partners, and families across the state, how much we need to think about early childhood as a system and improve that system and the way it functions. We also know we need a workforce that's paid a thriving wage in order for any of the rest of our hopes for that system to be successful. Next slide, please. So here are a few top highlights of legislation. I will actually just go ahead and pass it over to my colleague Lauren to start with the first bill.
Thanks so much. Good morning, everyone. Next slide, please. Thanks. The first bill that we're going to talk about is House Bill 1223, or improvements to CCAP, which is the Colorado Child Care Assistance Program. It is sponsored in the House by Reps Garcia and Wilford, and in the Senate by Senator Cutter. This bill would achieve a lot of really important things to improve our CCAP program. It will simplify the application process for families. It would create presumptive eligibility, and it would implement accessibility practices, including expanding eligibility. This bill is so important because as of right now, we only serve as a state about 11% of CCAP eligible kids. So it's really important that we expand that access and start serving more of those kiddos. Interestingly, about 2 weeks ago, some new federal guidelines came down around the Child Care and Development Block Grant, which is the primary funding source for CCAP. And we're really pleasantly surprised by that because we weren't expecting them till early summer. But the bill, this bill conveniently aligns with big portions of these new guidelines. And so we're hoping that the legislature sees the value in its passage as much as we do. Some key points to this bill are that it would limit parent copays to no more than 7% of family income. Currently, that cap is about 14%. It would create a uniform statewide application that doesn't ask for extraneous information, which is really important for families. A lot of times those applications are just too much to fill out, too invasive. And the more families apply, the more families will be successful in their application, which means we're serving more kids. And then would also create presumptive eligibility, which means that families would get to receive childcare for 90 days while their application paperwork is being reviewed. That will help parents start working immediately or keep working and keep children in care. So this actually just yesterday passed out of the House Health and Human Services Committee on an 8-4 vote, and it's headed to appropriations. So we will have more to share in upcoming publications. Next slide, please. The next bill is House Bill 241312, or the Care Worker Tax Credit, which we really see as working in concert with the Family Affordability Tax Credit that Sarah mentioned. This is sponsored by Reps Sirota and Garcia in the House and Senator Rodriguez in the Senate. And what it will effectively do is give a $1,500 refundable tax credit to care economy workers, which includes child care workers, home health care workers, certified nursing assistants, or other qualifying personal care workers, which includes family, friend, and neighbor providers, which we're so excited about. FFN providers, family, friend, and neighbor providers, play a critical role in the childcare space in our state, and they serve a lot of kids, and we're really glad to see that they're being valued in this bill. We all know how critical care workers are, not just to the economy, but to our society as a whole. We also know that they are extremely underpaid and that it's time to treat these workers as the professionals that they are, meaning paying them accordingly. So this tax credit would be a great first step to making these fields more sustainable career options. This bill is not quite scheduled for committee yet. The legislature is waiting for the March revenue forecast to then figure out how to manage all the different tax credits that are being proposed this year. So again, stay tuned for more legislative movement and updates. And I will pass it back to Melissa.
Thank you, Lauren. Another focus of ours this legislative session is House Bill 1332. This is a super technical bill that does one thing. It extends the rulemaking authority of the executive director of the Department of Early Childhood. So we are in support of this bill because we think that CDEC, the Department of Early Childhood, really needs to have that continued nimble, flexible approach to rules. We've seen that they've been able to take advantage of this approach by ensuring that in year 2 of universal preschool, children in extreme poverty below 100% of the federal poverty line will be able to access 30 hours per week of preschool. And there's just so much work that's happening at the department to align and streamline programs to make sure that everything can be successful. And so we are in support of the executive director retaining sole rulemaking authority. And in that, she is advised by what's called a Rules Advisory Council, or the RAC. And the RAC, I think, is an innovative approach to rulemaking in Colorado, where we were very involved in 2022, naming certain perspectives that needed to be on this Rules Advisory Council. And it really does highlight the lived experience of folks directly impacted by the changes the department is making. So there are family perspectives, provider perspectives across all settings. And the executive director of the Department of Early Childhood must go to the RAC for their feedback on any rule set. And if they offer recommendations to change the rules and the executive director does not take those recommendations, she is required by statute to respond with her rationale in writing. Our focus as advocates is to continue to demystify and make more accessible the rulemaking process overall. We know that implementation is much less flashy than legislation. It's also harder for folks to access, to understand what's going on. And we know also that families and providers are the reason we're here today with a new Department of Early Childhood rather than just a standalone additional funding stream for preschool. And so we need to make sure that they can still impact the development of these programs. Next slide, please. So we could talk this entire hour just about the budget and universal preschool, which are the next two things that I'm going to say. Broadly speaking, we are supportive of all of the budget requests for the Department of Early Childhood. Like I said, the systems level alignment that's happening takes a lot of time, a lot of people investment in full-time employees, technological improvements, and more. I will highlight that actually today, the JBC, the Joint Budget Committee, is taking up the final 2 budget requests that they did not already approve for the department on technology and workforce, and continuing a conversation about the home visiting request as well. One thing to highlight from this slide is that there's an across the board 2.5% provider rate increase for service providers of early childhood. And we think that's great. It's not nearly enough. And so our focus is on how can we get workforce, the workforce in early childhood, to feel like Lauren said, like they can thrive in a caregiving career. Next slide, please. Lastly, like I said, UPK, we could talk for a long time about, but we are deeply involved in implementation of universal preschool to make sure that it can successfully realize the vision of House Bill 1295 from 2 years ago, which is an improved program, one where families are easily able to access and understand the preschool that's available to them. One also that supports mixed delivery, meaning providers across school and community-based settings feel like they can both offer universal preschool and thrive in the program. A few things I'll highlight from here are the work that's currently being done, even this week, for example, at the Rules Advisory Council on the quality standards for universal preschool And then the work that Lauren is actually doing with the department and other partners to make sure that this resource bank, which is a new sort of collection of all the resources a provider could ever need to be successful in UPK, is actually developed in a way that really meets provider needs. So we're looking to connect with providers directly, as well as really be that bridge and that megaphone for folks who might not otherwise be able to have their thoughts heard at the department, to make sure that what's developed here is useful, that we have a rigorous program and one that really recognizes the diversity of our service providers and our families. Next slide, please. With that, I'm happy to pass it off to my colleague, Maddie, to talk about youth success.
Thanks so much, Melissa. Good morning, everyone. I'm Maddie Ashore, and I'm the director of our youth success work. Next slide, please. Just a little quick introduction. I was born and raised in Colorado. I attended D11 schools, got a degree in political science from the University of Denver, and I've worked in K-12 education policy for my entire career. I really do think of it as the front lines of the fight for our future and for our children's future, and I'm really honored to be a part of the Colorado Children's Campaign team. Next slide. This is our North Star goal in youth success. And what this really says to me is our work here at the Children's Campaign, or part of our work, is to ensure that all Colorado kids feel like they belong, that they have a place and a future here in Colorado, and that they matter and are important to us. Next slide. So to that work, in 2024, we have a couple of priorities that I'm going to highlight today. We're working hard to improve our school finance system. I'll say more about this, but it's been 30 years since we made a substantive update to the math problem behind how we divvy up the state's resources to the state school districts to support education services. So we've got some really exciting updates there. We're also working on investing in out-of-school time, or after-school and summer learning programs. As the state closes opportunity gaps in early learning spaces and drives a more equitable school funding formula or school finance system, the out-of-school time space, the hours of 3 to 6 p.m. and then summertime, will be the next place that Colorado needs to focus on putting some equity or equalizing Colorado kids' experiences in those times, especially for working families. And we're also working on a couple of bills to increase our investment in youth well-being. In the 2023 Kids Count, there's lots of data about how Colorado kids are struggling mentally and emotionally. About 40% of kids reported having persistent thoughts of hopelessness or sadness that was interfering with their daily activities in the 2021 Healthy Kids survey. So working hard on that. Next slide, please. So starting in school finance, the big update so far this legislative session is that the Joint Budget Committee, the JBC, has voted to officially eliminate the budget stabilization factor. For anyone who's from Colorado or who's been working on this issue for a long time, I do want to give us an opportunity to have a ding dong, the witch is dead moment. So drop in the chat if you're excited about this, if you've been working on it, if you know what the BSF is. The budget stabilization factor was established in 2009 in sort of a reaction to the 2008 financial crisis. So state revenues fell by about 10%. And when the legislature sat down to balance that year's budget, they realized that they wouldn't have enough to cover the constitutional requirements of Amendment 23, which requires a certain increase in school funding levels every year, and balance the rest of the state budget with this declining revenue. So they created the budget stabilization factor, which is just a budgeting mechanism that works like an IOU. And since 2009, this IOU from the state to the school funding system has racked up about $10 billion. So that's $10 billion that the state is constitutionally or is technically constitutionally required to provide to the state funding systems, but just wasn't able to. So a couple of weeks ago, the JBC voted to eliminate this, eliminate the use of it, and eliminate the way that the people who set the budget apply the budget stabilization factor to draw some dollars out of district budgets. So it's a huge win. Folks have been working on this for more than 10 years now. This is a picture on the slide of Heather and I attending the Colorado Education Association's big pep rally for the end of this. It was Taylor Swift themed. That's why you've got that picture of that charm bracelet. So very excited. This is a huge step forward for school finance. Next slide. So in addition to saying goodbye to the budget stabilization factor, which will drive an increase in school funding levels generally, we're also hoping to say hello to a new school funding formula. So in the 2023 School Finance Act, the legislature established a task force essentially to recommend to the legislature some updates to the school funding formula. As I mentioned previously, the last time we updated or changed the school funding formula was in 1994. So Friends was premiering that year. It was a long time ago, and a lot has changed about our education system and about what education means since that time. So this is really overdue. There were a lot of recommendations that the task force made, but the ones that I want to draw your attention to are first, that the task force has recommended that we change the order of operations in the school funding formula. So right now, when the state sits down to do this math problem to figure out how to divvy up the $9.4 billion that we spend on education each year, they look at district characteristics first. So they look at things like cost of living, remoteness, sparsity, characteristics that sort of tell the funding formula what a district looks like and the kind of students that they're serving. In the new funding formula that the task force is recommending, student characteristics will be considered first. So things like special education, ELL students, students who qualify for the at-risk measure. So that shift alone, changing that order of operations, makes the funding formula what we call more student-centered or more student-driven. And it'll mean that students who have higher needs will get higher resources or higher funding. That brings us to the next slide. So in addition to changing that order of operations, the task force is recommending that we increase the weights for these particular student populations. So it used to be that for every kid that a school was serving that qualified for the at-risk measure, they'd get a 12% weight. The task force is recommending an almost tripling of that weight up to 30%. So you'll see a big difference in the amount of money that these particular groups of students will be receiving and will be driving in the funding formula moving forward. I also want to draw our attention to the increase in English language learner funding. As the state works to welcome all of the new migrant families into our systems, into our school systems, there has been a pretty loud and resounding cry for some increased support from the state for those students and for the schools that are serving those students. So we're seeing, again, almost a quadrupling of the amount of money that those students will receive in the funding formula. So a huge win. The funding formula updates will happen in a bill that will happen after the School Finance Act, which happens after the long bill. So we're hoping to see bill language and some legislative conversation about realizing the recommendations of the task force, probably first or second week of April. We'll be keeping everyone up to date about this. So that's school finance. Moving on to investing in out-of-school time. So the Colorado Children's Campaign has been working with the Boys and Girls Club, the Colorado After School Partnership, and a bunch of other partners to run a bill to create a $5 million out-of-school grant program. So right now, the way that out-of-school and after-school programs are funded is very patchy. Some programs do it this way, some programs do it that way, and ultimately, there are 5 kids on a waiting list for every 1 kid that gets into an after-school and summer learning program. That is a big equity issue and creates a lot of problems for working families who need that additional support and that care. So HB 24-1331 will create that grant program. It's starting with a small overall investment just given the budget tightness this year, but we're hoping to grow it over time. Another exciting thing about this bill and about this new grant program is that it sets up sort of an infrastructure for a bigger investment in these programs going forward. So the After School Partnership and the After School Alliance and Boys and Girls Club have been working really hard with the Department of Education to figure out how to set up the data systems, the communication systems to ensure that going forward, every kid who needs access to an after-school and summer learning program can get that access. Up next, we have investing in youth well-being. So this is Senate Bill 24, number 1. Usually the first bill that is introduced or gets that 01 slot is a widely agreed upon bipartisan, exciting bill that folks are really looking forward to moving and getting done in a particular legislative session. And so the iMatter program was chosen for this year's Senate Bill 01. The iMatter program was established a couple of years ago to address the 2 main barriers that Colorado youth face in accessing mental health supports, which is cost and then getting enrolled or getting access to a particular therapist. So under the iMatter program, any Colorado youth can go online, call a hotline, and get connected to 6 free therapy sessions about whatever issue that they're facing. So far, 10,899 individual Colorado youth have benefited and used this program. The Behavioral Health Administration knows that there are about 13,000 additional youth who would be eligible or could benefit from this program. So the legislature is excited to invest an additional $11.1 million to keep the program going and just to continue to get youth connected to the services that they need to get mentally healthy. I think that's everything in the youth success world. So I'm very happy now to pass it over to my colleagues, Tony Sarge and Hunter Nelson, to talk about our child and family health pieces.
Thank you so much, Maddie. Good morning, everybody. My name is Tony Sarge, and I use she, her pronouns, and I am the Director of Child and Family Health here at the Colorado Children's Campaign. With me to present on our health legislation today is Hunter Nelson, our incredible senior policy analyst who supports our child and family health work, along with a lot of the other portfolios that you heard about this morning. We're so grateful that you're here with us this morning. So in our health portfolio, keeping kids and families healthy is what guides our policy priorities and our direction, and is what we always are going to keep central to our legislative and advocacy work. Going into this legislative session, our health portfolio was largely focused on these first 3 areas that you see here, and we added a 4th area to check in on today. The Colorado Children's Campaign didn't lead on any health-related legislation this year, but we've been supporting a variety of bills around school-based health, health coverage, maternal health, gun violence prevention, and more, in addition to advancing implementation work around some important programs and policies. So first, I'm so excited to share that our Senate Joint Resolution passed in both the Senate and the House. This resolution spoke to a commitment to supporting our state's Title X family planning clinics across the state. So for those who don't know, in Colorado, our Title X funding is a critical source of healthcare funding that supports access to family planning services across 80 clinics. But this funding is not where it needs to be. Some estimates say we're serving less than half of the folks who need these services. So with the passing of this resolution, we brought attention to this important challenge and opportunity, and we'll continue to push for additional program funding in the future. A special thanks to our sponsors in the Senate, Senator Marchman and Buckner, and our sponsors in the House, Representatives Wolford and Lukens, as well as many of our partner organizations who signed on and supported these efforts. So in the maternal health world, we've been involved in both implementation and legislative work over the last several weeks. So we're excited to share that we are moving forward with Medicaid reimbursement for certified professional midwives beginning next month in April in birth centers, and then in home births later this year in the fall. We've also been working with HCPF towards Medicaid coverage of doulas, which is still on track to begin this summer. We've also been actively supporting 2 bills that highly influence maternal health and well-being, Senate Bill 93 and House Bill 1262. So Senate Bill 93 would allow pregnant and postpartum folks who are switching between their state-regulated health insurance carriers to continue to receive care from their current provider or facility until the completion of their postpartum care at their in-network level under their new coverage plan, if they choose. So this is a really important way to make sure that our pregnant and postpartum folks are staying healthy and getting that continuity of care. House Bill 1262 does a variety of things to just support mental health outcomes, including increasing access to midwifery care by elevating the role of certified professional midwives. This bill also supports more research to understand why we're having closures of perinatal health facilities across the state, especially in rural areas, and how we can prevent those, as well as looking into maternity care deserts. An exciting update, both of these bills passed out of their most recent committees yesterday. And so Senate Bill 93 is headed to the House floor, and then House Bill 1262 will head to Appropriations Committee next. I'll pass it over to Hunter to talk a little bit about more about some of our other health priorities.
Awesome. Thank you, Tony. Yeah, very exciting things. So I want to give an implementation update on a bill we led in partnership with so many organizations and advocates last session, House Bill 23-1300. This bill requires the Arkansas Department of Healthcare Policy and Financing, or HCPF, to seek federal authority to implement continuous coverage through Medicaid and Child Plan Plus for children birthed through age 3, and 12 months of continuous eligibility for adults leaving prison facilities in Colorado state-run prison facilities. So expanding sort of the amount of time between when families have to go through the Medicaid redetermination process, regardless of fluctuations in income. So the department has decided to amend a current Section 1115 waiver, which is the federal authority route we have to go to implement these policies, to receive this federal authority. And they must submit it to the Centers for Medicare and Medicaid Services, or CMS, by April 1st, 2024. So in a few weeks. This includes both a state and federal public comment periods, and the state public comment period closed on February 24th, so a couple weeks ago. We submitted comments in support and attended both the hearings they held on this amendment, this waiver amendment, and we were able to obtain 16 additional sign-ons to our comments in support of the waiver amendment. So very exciting stuff. The federal comment period will open shortly. We are excited that Colorado is joining the cohort of states that are developing or implementing continuous coverage policies, as evidenced by the map you'll see on the slide. And we just really thank our leaders at our State Department for moving this work forward. And we wanted to add an implementation update on healthy school meals for all. This was a referred measure to the 2022 ballot. Many of you are probably aware, Proposition FF, and it was approved by Colorado voters in November of 2022. So the program began providing free breakfast and lunch to all students in eligible districts at the start of this past school year, so 2023. We are seeing a higher than expected participation for the free meals, which is a good thing. That means that people are taking advantage of the program, that it's needed, and it shows how much this program is needed and is helping Coloradans and Colorado students across our state. However, we are also finding that the program costs are also higher than expected for a couple of major reasons. First, our federal reimbursement rates are lower, so we're not drawing down as much federal dollars as was expected to support the HSMA program. And we're also seeing a higher paid student participation. So these are students otherwise not eligible for free or reduced price meals. And we're seeing more of them participate in the program. Again, it's not a bad thing. These are all good things to celebrate. But this has led to a funding shortfall that was initially estimated at roughly $19 to $24 million for this school year for just the meals, and then $20.5 to $26.5 million for next school year. This doesn't include the HSMA grant programs that were set to launch this fall. There were a number of grant programs included in that ballot measure. However, preliminary forecast estimates now show that Prop FF revenue will actually be higher than initially estimated. We just found that out last night during the JPC hearing. So it's going to close that revenue gap. It's going to close some of that funding gap to only 10 to 15 million, which is positive news, but it's still a funding gap that we need to fill. So The Joint Budget Committee, or the JBC, did vote last week to fund the meals, but they have not yet identified a funding source. So there will be a bill we expect to see sponsored by the JBC to delay the grant programs and provide greater flexibility on how we are administering HSMA programs as well as the community eligibility provision, and that's a whole other conversation. And we're working with our food partners to identify funding solutions to make the HSMA program sustainable, both in the short term and long term, because we want to see this program continue to serve all students in Colorado the way that it has been. With that, I will pass it on to Heather to close us out and facilitate the Q&A.
All right, thanks everyone. That was all very helpful. So now's the time for questions. So please, if you have questions, put those into our Q&A. The first question I actually see in the chat, and it is for Sarah. And Sarah, Jacqueline is wondering about how much the eviction filing fees are now.
That's a great question, Jacqueline. Thanks for asking. I believe they're about $85 for someone to file an answer to an eviction. And so for families who are already facing a lot of financial barriers, most likely if they're facing an eviction, that can be a pretty significant barrier. So it's a great question.
Thanks, Sarah. This is probably a question for Hunter or Tony. Any word on the child passenger safety bill?
I'll pass that to Tony. She's been following that a little more closely, but I'm not sure any updates. As far as I know, it's been progressing through the legislature pretty seamlessly, but I'll pass it to her to clarify.
Should we come back to this, Tony? Do you have any updates? Okay. So we have a couple of things that we have answered, but I'm gonna just ask our staff to answer out loud because they answered them in the Q&A. One is, I think this is for you, Lauren. It's the FFN providers and with the CARE tax credit. So what will FFN providers have to provide to prove their profession and receive the tax credit? And will they have to claim qualified exempt?
That's a great question. And I see, thank you, Melissa, for answering that in the chat. That is something that the sponsors are working out right now, but it will be an attestation process to make sure that all FFN providers could be eligible.
Awesome. Thank you. And then another question for the early childhood team. The 2.5% provider rate increase is for the childcare educators to state programs or UPK providers. To clarify, it does not increase the rate to support early childhood councils that work to directly support the ECE workforce, correct?
Yeah, I'm happy to answer that one, Heather. Yes, so I put in the chat the populations of professionals who the rate increase covers. It's family resource centers, CCAP providers, childcare licensing, early intervention, nurse home visiting for school readiness, child maltreatment prevention, early childhood mental health services, and social emotional language grant programs. And these are providers who are paid through the programs that I just listed. The other thing that's really great is that Lauren actually manages a spreadsheet that is updated on the early childhood budget. And so I'm sure that we'll have more to add after today's conversation at the JBC. But I did put that link in the Q&A, and I can drop that in the chat as well.
Okay, we have one more early childhood question and then a health question. So this is about UPK. LCOs are getting about 50% budget cuts. Thus, it is unclear how the UPK agenda/bill can get supported or implemented locally. Is this something you've been following or advocating for? Melissa, I think you can answer that.
Yeah, happy to answer that. So we actually did hear about this and can happily say that was totally incorrect. So there was a mistaken communication with LCOs about a 50% budget cut, and the department actually reached out to us and to LCOs directly to say that that's incorrect. Brian, I'm seeing that you say that's not true. So I spoke directly with folks at the department who told me that it was a mistake. I'm wondering if you could share that with me, because it just does not align with what you're saying. So I would love to see the information so we can get to the bottom of this.
All
Thank
right,
you.
Melissa, can you put your email in the chat and then he can connect with you offline? Hunter, I know you answered this online, but I'm going to ask it out loud as well. So this is about Senate Bill 2493. Does it only include enrollees in Medicaid or private insurance carriers? They want to clarify that it would not cover those who are enrolled in TRICARE. Is that correct?
Yes, that is correct. So these continuous continuity of care protections, I should say, would only apply to state regulated plans and then Medicaid as well. So because TRICARE has federal authority, it would not apply to them, unfortunately. And then also I wanted to say with the child passenger safety legislation that the last status of that bill was that it passed out of the House Committee on Transportation, Housing, and Local Government and has been referred to appropriations. There was an amendment included as well that changed a number of things, not anything big that changes the substance of the bill, but it also does include if I can talk, the possibility for ticket waiving if someone's pulled over for not adhering to these new child passenger safety guidelines, because they are going to be new for folks. If they complete like a education course, that they can have the possibility of their ticket waived. So I know that's been some concern as well.
Great. Thanks, Hunter. And then, Tony, do you want to address the child passenger safety bill so everybody hears the answer to that as well?
Thanks, Heather. I think Hunter covered it all. I just wanted to double check that it hadn't yet been scheduled for appropriations, but it looks like it has not. That's where a lot of bills that have also been mentioned already today are waiting for next steps in relation to the budget. So that's where that's at, and that did have good support in it early on when it was heard earlier on in the session.
All right. Awesome. Thank you all. I don't see any other questions. Hopefully I got them all. We just have a couple of other things that we want to share while we have you all here. And the first is that next week, March 20th, is Speak Up for Kids Day, and that is our annual lobbying day, and we are doing that in conjunction with the Clayton Early Learning, and we're really looking forward to it. Hopefully some of you joined us in January for the first part of Speak Up for Kids, where we did some training. Next week is actually completely full, but you can still join our wait list, and we'll put a link in the chat so you can join the wait list. And you're always welcome to come to the Capitol, whether it's Speak Up for Kids Day or not. The next is, this is not until September, but mark your calendars. Our connection reception will be on September 12th. And we have some really exciting things planned for that event. And so we hope you will join us at the Grand Hyatt, at the Pinnacle Club. If nothing else, there are beautiful views from up there. So please come. And then finally, we are constantly at the Capitol and we're constantly updating information. So we would love it if you would follow our work every day by subscribing to our Kids Flash newsletter, or listening to the West Steps, which is our podcast. A lot of the issues we talked about today, we've actually done podcasts on, so you can get more information and hear conversations with bill sponsors or community partners who are also part of this work. And then finally, please follow us on all the social medias. We love to post pictures and things as they're happening at the Capitol, so that's a great place to stay linked in with us. And then thank you all for being here. If you have further questions, please feel free to always reach out to our team. We're happy to answer questions. And I know we still have a few things still out there with the early childhood councils, and we'll follow up on that. But I hope you all have a great day, and I hope you're all ready for a big snowstorm. Thanks so much.